Thoracic outlet syndrome. Causes: anatomic variation that causes compression of neurovascular structure in suprascapular fossa as they pass over the first rib. Muscular tenderness anomalies, cervical rib, clavicular first rib and first rib malunion, hypertrophy in athletes, and Pancoast apical lung tumor. Rarely seen, seems more common in the middle-aged female. Presentation: neurological symptoms, lower trunk symptoms, C8T1. Vascular symptoms: subclavian artery aneurysm, microemboli in the hand, upper limb claudication, local symptoms: hard lump. Clinical assessment: Atson test, arm abducted and head extended and rotated towards the affected side, radial pulse obliterates on deep inspiration. Normal finding in 10% of population. Roos overhead test, both shoulder in 9-degree flexion, abduction and external rotation. Rapidly opens and closes arm for 2 minutes, weakness, paresthesia, and loss of pulsations. Imaging: X-ray of the cervical spine and chest X-ray. Angiography. Treatment: physiotherapy, improved posture, Botox injection to the scalene muscles if the muscle is the cause, surgical decompression, transaxillary first rib resection, release anterior and middle scalene muscles, heparinization of hand emboli. Remove the cause.